All right. Hi, everybody. Welcome to another edition of 10 Minutes with JPIDS. I'm your editor-in-chief, Ravi Jhaveri, and it's really a thrill for me to have one of my team members here, Dr. Caitlin Lee from Lurie Children's.
Thanks for having me, Ravi.
Yeah, absolutely. So we're excited to talk about a recent article. And full disclosure, I have a conflict of interest in the sense that I'm a co-author on this article too, and helped start with this. But um, the listeners we have know by now that I'm a superhero nerd and like to ask everyone to give us their origin story. So, can you talk about what your ID origin story is?
So it's funny. If you ask anyone who knew me in college, they would tell you that this is exactly the job that they would picture me having, but it took me a little bit longer to figure that out. And so the very first project that I ever worked on was implementing HIV testing in the state tuberculosis clinic in Rhode Island, and had amazing mentors, loved all of the work that they were doing in ID, had a lot of great learning experiences then. Thought I was going to do adult medicine, fell in love with PIDS in med school. In my PIDS residency, went through a phase where I thought I was going to be an emergency medicine physician. Turns out I didn't actually tell everyone in my residency that I switched from ED to ID. So on match day, there were some people thought that they got the vowel wrong on the match list, but I figured it out just in time and now get to have a job that I love coming to every day.
That's great to hear, not just because I'm your division head, but it's funny. My origin story in ID is a little bit similar. I had a job with sort of as a data manager at the PEDS ID division at Boston City Hospital, and for years thought I was going to be a sports medicine orthopedic surgeon. And only years later did I figure out that I had found what I was going to do the rest of my life, long before I knew it. So anyway, let's start to talk about the article. So first, maybe we'll start with a fundamental question, which is what is an interprofessional consult for those who don't know?
So, an interprofessional consult is a provider to provider consultation. And so, if we're speaking really simply, an interprofessional consult is the formalization of a curbside, but in a safer way because it's documented and something that you can use appropriate CPT codes to bill for. There are two different types of consults that people talk about when they're talking about provider-to-provider consultations. So there are these interprofessional consults where you both have a verbal or a phone consultation with the requester and you put a note in the chart. And then there's something else that people also talk about called e-consults where you don't need to have that verbal piece of the conversation.
All right, thanks for clarifying. It was going to be one of my future questions about e-consults, so thanks for answering it in advance. So, do you want to share the story of how we got started on this particular project?
So we actually started working on this because we saw this huge area of opportunity in the calls that we get about Kawasaki disease from our emergency department. So we're a hospital where ID takes care of Kawasaki disease. And as everyone knows, it can be a really tough diagnosis to make. And we know that our emergency department colleagues really value ID expertise. And so we'll often call and ask for many, many things about infections, but they will also call and ask, do you think this kid has KD? And we know that if things aren't documented, it's like a game of telephone. And so sometimes what is passed down after multiple handoffs is not necessarily the exact same thing that the fellow who was answering the call said to the provider who originally called them. And so we started by standardizing, documenting those Kawasaki disease calls. We didn't have a billing component at that point, but the fellows started to document the calls. The ED providers loved the fact that these verbal conversations were documented in the record and that people could refer back to them. And so then we looked around, we saw some of the resources that had been put out by IDSA and heard about these CPT codes, saw that there were really no data out there on whether or not they were reimbursed in pediatrics. A lot of the education that's provided by IDSA, which is lovely and thorough and thoughtful, really focuses on the fact that these are Medicare codes and focuses on the fact that Medicare is required to cover them, but other insurers aren't. And so we decided we were going to do a pilot trial and set it up. just keep iteratively watching to see if they were being reimbursed to see whether it was worth continuing to scale. And we were really pleasantly surprised to find that it was.
Yeah, I think the people who have heard about this work, I think that's what resonates most with them is it's us getting compensated for work we were already doing and felt a lot of burden for. You did a lot of work in laying the foundation for this. Can you talk about the key things that you did to make this project launch successful?
Yeah, so the things that were really important, it's like all QI work, it was really important to have buy-in from our stakeholders. And this work crosses not just our division, but a lot of divisions in the hospital. So we needed to have buy-in from those who are really going to be doing these. So from all of the attendings in our division, from our nurse practitioners, from our fellows, and also from those who are going to be who were calling us with these questions to make sure that they were comfortable that this was something that we were going to be doing. We had to work with those in our billing department who are really involved in the revenue cycle to make sure that they were educated in what these codes are and knew how to recognize the notes and that they needed to apply the billing codes appropriately. At our hospital, our inpatient and ED consultations are billed by a billing team. We do our own billing for outpatient consultations. Um, and we also needed to make sure that we discussed this with our legal team and our compliance team to make sure that we were following all of our appropriate hospital regulations.
Yeah, so it's not something you can just hit a button, upload a template, and start doing it. I think that's important that it needs to be fertile ground, and so I think you deserve credit for tilling all the soil and allowing the seeds to grow. So now that we've got this far and we're, just shy of a year of having done this, what are our future plans for this IPC project?
Well, what's been really exciting is the amount of feedback we've gotten from other divisions in the hospital about how much they love these on the receiving end. So people like the ED, they love seeing these recommendations documented, really feel like it reduces the potential for error and communication. And so we are really excited that a lot of other divisions in our hospital are going to start to implement them as well, and that this might become a more formal process of, or part of our process around consultations in general. We're also doing we are continuing to discuss as a division what is the role for including our trainees in this process. And so we have figured out all of the regulatory considerations around that. And we're really trying to decide what's the right balance when there are so many learning opportunities for our trainees. Should they be involved in all, some, or none of these?
I'm just going to ask you a follow-on question too. We didn't really talk about. So as we think about sort of our bandwidth for outreach and helping support the care in more remote areas, where do you think IPCs is a possibility? Do you think it's more e-consult? What do you think is going to be the future?
Yeah, so I've actually been asked this question by some of our colleagues at other hospitals, and I think that there is so much value in being able to offer IPCs to patients who have not touched our hospital system before. I think that there are additional issues around consent in that, and there are also there's some things that we would have to think about how to bill. Because if it's a patient who has never had an interaction with our hospital system, we don't have a process in place for getting their insurance information. And so I have not yet cracked that, but it's something that I think we can continue to think about. How can we make sure that patients who might not otherwise have access to ID expertise can get access in this way, and also providers can continue to be appropriately compensated for the cognitive effort of offering that expertise.
Yeah, it seems to me that, like I'm away from home and had to click a uh, agree to terms button when I joined this wireless network. And it seems to me that there's probably something we could do via text message or something where that kind of information could be shared between providers in a way that allows patients to opt in to allow their information to be shared. So that's our next project, maybe.
Sounds
Not
great.
not to give you yet another project. Um, okay, just before we wrap up, is there anything that I didn't ask you that you wanted to share with the audience?
No, I think that we are just really excited to have the opportunity to share this success. And I think it makes me really proud to be part of a PEDS community that is so eager to help one another and to learn from one another. And so we are just really excited to share what we learned in this process. Hopefully others can benefit and remain dedicated to helping support others who want to do something similar.
Well, again, thank you for spearheading this project. For those who are listening and are interested in learning more, we're going to do a webinar in partnership with PIDS so we can sort of share a little more detail about how we did things. And we'll be sharing templates and sort of a playbook for how we got this off the ground for those who want to do it at their sites. So, Caitlin, thank you again for joining us. Thanks for doing this project. And to our listeners, we'll see you next time. Thanks so much.